So the healthcare delivery systems worldwide are faced with same set of problems, including rising cost, aging population, the requirement to meet their nation's health needs. But they differ in the variety of their approaches to addressing these problems. Okay, well, entitlements based on citizenship, and here we're talking about health benefits, are aimed at providing people with welfare and health benefits regardless of their class positions. Social welfare systems of Europe are more advanced in this direction than in the United States. Americans have historically been less committed to government welfare programs and more in favor of private enterprise in dealing with economic and social problems. And that also pertains to the healthcare system in the United States compared with those in European countries. Okay, so let's look into the history of the development of healthcare delivery systems in the industrialized world. Germany established the first national health insurance program in 1883 and followed by Austria in 1888. Okay, well, let's talk about the United States. The American healthcare delivery system is by far the most expensive in the world, all right? And probably the least effective in the industrialized world. Okay. On the two most common measures of a country's overall level of health, infant mortality and life expectancy, the United States does not rank especially high. It turns out, actually, the United States ranks towards the bottom of all major Western industrialized nations. Right? And the students can check into textbook or simply Google about basic health outcomes of the United States compare with those of other nations, especially industrialized countries in Europe or in North America, like Canada. Right? Okay, let me start talking about different types of healthcare delivery system. Okay, and here I'm going to get into two major categorization systems. And let me begin with the one discussed in our textbook first. So our textbook categorizes all major healthcare delivery systems into four types. Fee for service, right? It's when patients visit clinics or hospitals, they pay upfront, right, for the service received. And the second system is called socialized medicine. And third one is decentralized national health system. Last but not least is socialist medicine. So along the x-axis for all the columns. And for these rows here, we have different features by which, with which we use to categorize these different, four types. So first is government regulation. Okay, and in fee-for-service system, it's limited. Okay, in socialized medicine, there's a lot of regulation, very high direct. In decentralized national health system, the role of government is, limited. Regulation is indirect. In socialist medicine, the intervention, the government regulation is direct. Then the second feature is payments to providers. Again, fee for service, okay, in terms of directness, it's limited. It's limited, okay? And for socialized medicine, it's direct. Decentralized national health insurance system, indirect. Socialist medicine is direct. About ownership of facilities. For fee-for-service system, in fee-for-service system, ownership is private and public, a mixture. Under socialized medicine, ownership of facilities are either private or public, so both types. Decentralized, same thing. Under socialist medicine, the ownership of a facility is public. For public access, well, fee-for-service, it's not guaranteed, okay? The providers can reject, okay? Access, deny access. Under socialized medicine, it's guaranteed. Decentralized national insurance, guaranteed. Socialist medicine, guaranteed. For private care, under fee-for-service system, it's dominant. Under socialized medicine, it's limited, okay? And under decentralized national healthcare system, it's limited. And under socialist medicine, it's unavailable. So in general, by going through all these features, we would know different types of healthcare delivery systems would do. Okay? So let's first talk about socialized medicine in more detail. So socialized medicine refers to a system of healthcare delivery in which healthcare is provided in the form of a state-supported consumer service, right? Healthcare is purchased by the government. So healthcare is purchased by government, which makes the services available at little or no additional cost to the consumer. Okay, so that's for socialized medicine. How about decentralized national health programs? Well, it is a system of health care delivery in which government control and management of healthcare delivery is indirect, so indirect regulation. Government acts primarily to regulate the system and functions in the role of a third party that mediates and coordinates healthcare delivery between providers and payers. While in socialist medicine, healthcare delivery features central government ownership of all facilities, employment of workers, and free universal care paid out of national budget. Okay. So that is, the kind of system or paradigm discussed in our textbook, which I'm not very happy with because it does not differentiate some nuanced areas of some of industrialized nations. So my personal preference, still not very satiating, satisfactory, okay, is the TR rate model, which I prefer, okay? But again, here, I don't want to impose my personal views on my students, okay? So this is an alternative categorization. So again, 4 models, including the Beveridge model, or very similar to socialized medicine. Second is Bismarck model. Sometimes it's called social insurance. And third one is national health insurance model, which has components from the Beveridge and Bismarck. Okay, then is out-of-pocket model, which is literally same thing as fee-for-service. Okay, so what is the Beveridge model? It's also called socialized medicine. It's purchased by the government, financed through government tax. Many hospitals and clinics owned by the government. And countries, regions use this system, include UK, Spain, most Scandinavian countries, New Zealand, Hong Kong, okay, and Cuba. Second is called the Bismarck model. Sometimes it's also called social insurance model. Why it's called Bismarck model is because Bismarck, as Chancellor of Prussia, established the first modern national health insurance program, right? To provide welfare, health welfare. Okay, well, it's provided by private practitioners, financed through sickness funds. So what are sickness funds? They are nonprofit insurance companies, okay? And financed through employer-employee deduction. Also, the government takes care of the rest. Countries use this system include Germany, France, Belgium, Netherlands, Japan, Switzerland. Third one is called national health insurance, okay? It's provided by privately owned hospitals and clinics, financed through government-run insurance that every citizen pays into. Okay, so everything else, this system is very similar to the Bismarck model. What it takes out is the insurer part. Okay, no insurance companies. The countries include Canada, Taiwan, and South Korea. And that, last but not least, is out-of-pocket model, basically provided by privately owned hospitals and clinics, usually financed by patients, providers. The countries include most poor countries.